Good afternoon. I hope that you all had a healthy celebration of the new year. I'm optimistic that 2022 will be a year of recovery and success for everyone. So far, we have administered more than 19 million vaccines in Illinois, over 2 million of which have taken place at our state-run vaccination sites and thousands of mobile clinics. We have fully vaccinated nearly 90% of Illinois' excuse me. We have fully vaccinated nearly 90% of Illinois seniors, and 75% of eligible seniors have received their booster. We are the leader among the most populous states in the nation in 5 to 11-year-old vaccinations since the moment the FDA authorized them. And we have been leading all of our neighboring states in keeping people alive and out of the hospital despite the Omicron variant rapidly spreading. About our progress against Omicron. Unfortunately, we are reaching all-time record numbers of cases and surging hospitalizations, so we must approach this first several weeks of January with a good deal of caution. At a time when some have chosen to politicize vaccinations as a way to polarize our politics, Illinois state government is focusing on science, as we have throughout the pandemic, which is why we're redoubling our efforts to get more people vaccinated and boosted every day. The unvaccinated are the ones filling up 85% of our COVID hospital beds and 95% of our ICU beds, and nearly 100% of our ventilators. So getting vaccinated and boosted remains the strain on our healthcare workers and hospitals. In Illinois, as is true in many cases across the United States, our COVID-19 hospitalizations are now even higher than they were last winter when vaccines weren't yet widely available. Is still only a week or two in the rearview mirror. I fear the climb will continue as the virus incubates in those who were exposed at the end of December. In the pediatric wards, the number of Illinois children entering the hospital with COVID-19 has nearly tripled since the beginning of December. But staffed ICU beds for other emergencies like car crashes and heart attacks and strokes are frighteningly limited, in just the single digits. Last week, I joined the Illinois Health and Hospital Association in urging providers to postpone non-emergency surgeries so they can use existing staff to expand ICU capacity wherever possible. We have also adopted the CDC's updated guidance for healthcare professionals to shorten the amount of time that they need to be out if they are exposed to COVID or catch COVID themselves. Today, I'm grateful to be joined by A.J. Wilhelmi, the President and CEO of the Health and Hospital Association, and leading healthcare professionals who will share how their hospitals are handling this latest surge. It is frustrating and tragic that 2 years into the pandemic, with multiple widely available and free life-saving vaccines, that we are once again in this horrible position. Neighbors are holding off on important medical care like hernia repair, colonoscopies, and early-stage cancer treatments. We are on the eve of the second year of this pandemic. We have entered the third year now of this pandemic, and our hospitals and healthcare workers continue to care for their patients under extraordinarily challenging circumstances. They are under tremendous strain, and I don't know how much more they can withstand. We must all find ways to support them in every way possible. I'm here today to reiterate that we do have the tools to get through this. It's time for everyone to join in using those tools. First, stay home if you are sick. And if someone you know is sick, take extra precautions. Second, get your vaccination and get your booster. Third, wear your mask. An N95, KN95, or a surgical mask are best and reduce transmissibility by 53 to 90%. A cloth mask is less effective, but it's much better than no mask at all, and it provides some protection for the people around you. Lastly, if you have a relative, a coworker, or a neighbor who is hesitant about getting vaccinated, take them, sit them down, talk to them about your own experience. Soothe their fears. Reach out with kindness and with compassion, but above all, reach out. That conversation maybe begins by saying something like, "I care about you, and I really want you to be healthy and safe." Over the holidays, I announced the state of Illinois is more than doubling personnel and adding at least 100 people to local health department vaccination sites, reaching tens of thousands more Illinoisans every day. We also continue to bring boosters and vaccines into communities that request them. If your organization would like to host a vaccination clinic, please visit IDPH's website, where you'll find a link to sign up so that we can bring a vaccination clinic for everyone in your organization to you, everyone who isn't yet vaccinated or needs a booster. Testing is also vitally important for keeping you and your family and your coworkers safe. Starting today, our free community-based testing sites have expanded to 6 days a week to increase COVID-19 testing availability across the state of Illinois. That's a 50% increase. These free tests and test sites are located in Aurora, in Arlington Heights, South Holland, Fairview Heights, Peoria, Bloomington, Champaign, Harwood Heights, Rockford, and Waukegan, as well as at all local health departments. You can find more information about where you can get tested at coronavirus.illinois.gov. This morning, the FDA also made two very welcome announcements related to booster shots. First, 12 to 15-year-olds will be eligible to get their booster shots shortly. The CDC is expected to support the expansion later this week, and as soon as they do, Illinois will be ready to get eligible teenagers this extra protection. Second, the FDA moved to reduce the waiting period for Pfizer and Moderna boosters to 5 months from 6 months. The CDC is also expected to sign off on this reduction very soon, meaning that anyone who got their full Pfizer or Moderna vaccination before early August will be eligible for a booster shot. Millions of people here and around the world have safely gotten boosters, making them more protected more quickly, and this is good news. State government remains vigilant with widespread testing and vaccinations and maintaining healthcare capacity, and all Illinoisans need to focus on keeping each other safe. Where we go next as a state is a matter of all of us pitching in. Each of us can get vaccinated, get boosted, and wear our mask when in spaces with other people. And I ask everyone to do their part. So thank you, and now I'd like to turn it over to Dr. Ezike, who is joining us and speaking.
And Happy New Year to everyone. I was really hoping we could be in a better place to start off the new year, but the changing of the calendar gives us the opportunity to renew our fight against COVID-19. We do know how to prevent further spread of the disease. It's the same old. Get vaccinated, get boosted, wear your mask, avoid crowds, get tested. And all we need to do now is actually implement those things. We do continue to battle Delta. We have Omicron quickly taking over. And as Omicron spreads much quicker. Although initial information indicates that Omicron may not cause as severe illness as Delta, we are not seeing fewer people in the hospital. because there are just so many more people with COVID, period. The ratio of people with COVID-19 who are hospitalized compared to those who are not may be decreasing, but because there are just so many people with COVID-19, our hospitals are still completely overwhelmed. An average of 550 people are admitted to Illinois hospitals each day, every single day on average with COVID. And 90% of those people are not vaccinated, not helping prevent the potential death of someone whom they may unknowingly spread it to. I know you might say you're healthy and you'll be okay if you get COVID. And right next to you might not be as fortunate. The person next to you could be on cancer treatment, could have a decreased immune response to the vaccine. So when you aren't vaccinated and you don't wear your mask and you're sitting next to that person, you could inadvertently spread the virus and put them in the hospital or even worse. There are over 4 million people in Illinois who haven't gotten vaccinated. In addition to hearing that they don't think that they'll get that sick with COVID, we're also hearing people questioning why they should get the vaccine if they can still get Omicron and can still spread it. Facts are facts, and no vaccine is 100%. However, your chances of getting and transmitting COVID-19 are significantly, greatly decreased, as is your chance of getting severely ill or dying. It's been more than a year since vaccines started going into arms. Longer if you take into account the vaccine trials. So we have lots and lots of evidence that shows the safety and the effectiveness of the vaccines. Vaccines are truly saving lives. It's just that simple. So why don't we do something that could save a life? I also want to encourage people who think they've been exposed to someone with COVID-19 to get tested. Even if you have the mildest symptoms, a sore throat, a cough, fever, chills, just get tested. As the governor already mentioned, our community-based testing sites are offering free testing now 6 days a week, with additional free Shield testing locations across the state. Some communities are seeing pop-up testing, which are helping fill the demand for testing. And we're planning mobile pop-up clinics as well. We do want to urge some caution with some of these clinics. There unfortunately are those who are taking advantage of these crazy times to try to scam people. So if you have any doubts about the testing location that you're looking at, go ahead and ask some questions. What lab is the testing site using? When will you receive the results and from whom? The IDPH website lists the locations and the hours of the free community-based testing sites, as well as for the Shield locations. It also has a search function to find a testing location near you, which includes many local health departments as well as many pharmacies. I'm asking for your help in this new year 2022. Let's get more people tested. Let's get more people vaccinated. Let's limit the spread of this virus, and let's get closer to the end of this pandemic. And now I will summarize comments in Spanish. Feliz año nuevo. Realmente esperaba que estuviéramos en un mejor lugar para comenzar el nuevo año. Pero el cambio de calendario nos da la oportunidad de renovar nuestra lucha contra COVID. Sabemos cómo prevenir una mayor propagación de COVID-19. Vacúnese, reciba su refuerzo, use su máscara y hágase una prueba. Lo que necesitamos ahora es que la gente haga estas cosas. Seguimos luchando contra la variante Delta, pero Omicron se está apoderando rápidamente y Omicron se propaga mucho más rápido. Un promedio de 550 personas están en los hospitales de Illinois cada día con COVID-19. Aproximadamente el 90% de las personas hospitalizadas con COVID no están vacunadas. Personas que no se aprovechan de algo que podría salvarles la vida no están ayudando a prevenir la muerte potencial a alguien que conocen. Es cierto, ninguna vacuna es 100%, pero sin embargo, sus cambios para contraer y transmitir COVID se reducen en gran medida, al igual que su probabilidad de enfermarse gravemente o morir. Ha pasado más de un año desde que las vacunas empezaron a distribuir. También tengan en cuenta los ensayos de vacunas. Por eso tenemos mucha evidencia que muestra la seguridad y eficacia de las vacunas. Las vacunas están salvando vidas, así de simple. ¿Por qué no harías algo que podría salvar tu vida? También quiero animar a las personas que piensan que han estado expuestas a alguien con COVID a hacerse la prueba. Si tiene dolor de garganta, tos, fiebre, escalofríos, hágase la prueba. Como mencionó el gobernador, nuestros sitios de pruebas basados en la comunidad ofrecen pruebas gratuitas 6 días a la semana, con ubicaciones adicionales gratuitas para pruebas Shield en todo el estado. Algunas comunidades están viendo pruebas emergentes que están ayudando a satisfacer la demanda de pruebas. El estado también está planificando clínicas emergentes móviles. Pero queremos instar a la precaución con algunas de esas clínicas. Hay quienes se están aprovechando de estos tiempos horribles para estafar a la gente. Si tiene dudas sobre la ubicación de la prueba, asegúrese de hacer preguntas. ¿Qué laboratorio utiliza el sitio de pruebas? ¿Cuándo recibirá los resultados y de quién? El sitio web de IDPH encontrará sitios y los horarios de pruebas gratuitos basados en la comunidad y los sitios de Shield. También tiene una función de búsqueda para encontrar un lugar de pruebas cerca de usted, que incluyen muchos departamentos de salud y farmacias locales. Les pido su ayuda en este nuevo año. Ayúdenos a que más personas se hagan la prueba y se vacunen para que podamos prevenir la propagación del virus y poner fin a esta pandemia. Of the Illinois Health and Hospitals Association.
Thank you, Doctor, and good afternoon, everyone. First, on behalf of all Illinois hospitals, I'd like to thank Governor Pritzker and Dr. Ezike for their continued partnership and collaboration with IHA and the hospital community during this pandemic. As we know, COVID-19 cases are at record highs, and hospitalizations now are also at a record high, having more than doubled in the month of December. This surge is testing our healthcare resources yet again. In response, Illinois' hospitals and the state are working very closely together to preserve the integrity of our healthcare infrastructure, as we have since the very beginning of this pandemic. This partnership has been essential to preventing Illinois from exceeding capacity, but especially the hospital community. Hospital workers are fatigued and weary of this ever-present virus and its impact on their family, friends, and neighbors. They see and experience the heartbreak it has caused, but they remain committed and compassionate, and they are standing tall. Our hospital leaders and healthcare workers have learned a great deal over the last 2 years, and they're using their expertise to effectively manage their operations and care for patients. Hospitals have become very adept at expanding and contracting bed capacity as necessary to meet patient needs and to make sure every COVID patient has care. As the governor has highlighted, this includes the patient. Hospitals are taking this step to manage through this crisis. In fact, hospitals and healthcare workers are doing everything in their power to manage and care for the influx of patients that is beyond their control. We cannot emphasize this enough. Hospitals and healthcare workers and our government partners cannot end this pandemic on their own. It takes everyone. Avoiding the illness, and especially avoiding severe illness, is key. The overwhelming majority of the 6,300 COVID patients vaccinated and boosted is the best way to avoid severe illness and a COVID-19 hospital visit. It's also the best way to provide relief to healthcare workers and to assure healthcare is available to everyone. So again, thank you to Governor Pritzker and his entire team for their ongoing support and partnership with the Illinois hospital community. And now it is my distinct pleasure to introduce Dr. Omar Latif, President and CEO of Rush University Medical Center.
Thank you, Governor Pritzker, for asking me to be here today. We are grateful for the leadership that you and Dr. Ezike have shown throughout the pandemic. When we gathered here for a news conference in 2020, I said, Chicago is strong, and all our hospitals are made up of amazing people who will do whatever it takes 24 hours a day and 7 days a week, as long as it takes to get our community through this. I remember standing at this podium in this room saying that. None of us would have ever imagined that we'd be here again nearly 2 years later saying almost the same thing. Some things remain the same. The resolve and the commitment of healthcare providers across Chicago remains extraordinary. All providers have done and will continue to do whatever it takes to get our community through this. Healthcare workers around the country have sacrificed so much to take care of people, and they were and are heroes, and that is very real. Like every hospital across the state, Rush is closely watching our capacity and doing everything possible to ensure all our patients' needs are met. We have already across the country and across the globe that hospitals have had to do during prior surges. We've turned our the Brennan Pavilion. We've expanded virtual care, minimizing the need for travel. We have rescheduled some procedures when necessary, and in partnership with the Chicago Department of Public Health, we continue to test, vaccinate, and provide care in the most vulnerable and under-resourced communities, including the homeless community. At the same time, while those things are the same, some things are different. We have learned so much about how to treat this virus. Our outcomes are better and better in doing so. We have highly effective vaccines and boosters. During the pandemic, we were able to break down silos between hospitals all the way to home care, creating connections between partners across the city and state. All hospitals, nursing facilities, community health providers have figured out new ways to work together to combat the pandemic. We need to continue to work closely to best manage capacity and ensure that patients receive the care they need in order to save lives. And we need to learn from the earlier stages of the pandemic. Don't forget to care for your health. It's critically important that patients don't delay the care that they need. It's safe to go to the hospital and it's safe to come to Rush, and delaying care is not safe. Medical research and our clinical experience at Rush has borne that out. We know of patients who were fearful for COVID exposure who needed life-saving care, like one patient who had chest pain for 5 days but was too scared to come to the hospital. Fortunately, she came in time and was adequately treated, but we all need to be COVID safe. So please don't delay the care you need. And now more than ever, we need, as everyone else has said at this podium, everyone to do their part to overcome this surge and put this pandemic in our rearview mirror. Please get vaccinated for COVID-19 and the flu and get your COVID booster. Encourage your family and friends to get vaccinated and boosted. And don't forget, simple things like washing your hands still go a tremendous way. The virus is relentless, but the healthcare infrastructure in the city of Chicago, the state of Illinois, and the entire country is more relentless. Thank you.
Thank you. And now I'd like to introduce Jim Skogsberg, who's the president and CEO of Advocate Aurora Health, and he's joining us virtually. Jim?
Thank you, Governor. I'm pleased to speak on behalf of our 10 Chicagoland hospitals and over 250 sites of care. And I'd like to start by recognizing our 40,000 Illinois-based team members. We are so grateful for the exceptional work they do to serve our patients every single day. And thank you, Governor, to you and Dr. Ezike for your public health leadership, especially around efforts to ensure access to vaccines for every community in our state. Like all health systems, Advocate Aurora has never been more challenged than in the last 2 years fighting COVID-19. Beds are full, wait times are long, and the doctors, nurses, and countless others who have so skillfully and compassionately cared for our communities are struggling. We have 963 COVID positive patients currently admitted in our Illinois hospitals. That's more than double we had 30 days ago, and the highest number we've seen during this entire pandemic. We're also caring for another 213 COVID positive patients in their homes. Like others, we are managing capacity and staffing amidst a national staffing shortage. We are redeploying outpatient nurses, paying top dollar to recruit and retain talent, and leveraging telehealth. We're grateful for the growing number of Advocate Aurora team members who have stepped forward to be redeployed and to fill needed roles. More than 1,100 team members have volunteered, covering more than 3,000 shifts. We're also delaying and rescheduling non-essential procedures as necessary. But the reality is that much of this unbelievable stress is preventable. More than 90%, as all the speakers have said, more than 90% of all COVID patients in the hospital today are unvaccinated or overdue for a booster. This trend is something all hospitals are seeing across the country. Vaccines and boosters are the key to reducing hospitalizations and death from COVID. We can't stop COVID without you. Together, we can lessen the strain on our state's healthcare system so that you and your family can access care when you need it most. So here's what you can do to help. First, as has been said before, get vaccinated and get your booster. That's the most important step you can take. Second, keep having those tough conversations with loved ones about getting the vaccine. We only get past this pandemic as a community. Third, if you or someone in your household starts experiencing mild COVID symptoms, call your primary care provider or use our Advocate Aurora online system checker to understand if you need to be evaluated by a clinician. And if you experience severe symptoms, of course, go to the emergency room. And finally, reach out to the healthcare providers that you know personally or rely on for your care. They've been on the front lines for 2 long years, and your acknowledgement would mean a lot. Thank you, Governor Pritzker and Dr. Ezike.
Thanks. And we have our final guest today is Gabriel Cummings. Gabriel is the president of Highland Park Hospital at North Shore University Health System and joining us today also virtually. Gabriel?
Thank you, Governor Pritzker. On behalf of North Shore University Health System, our CEO, JP Gallagher, and our thousands of team members, thank you for the opportunity to contribute to this important discussion. We appreciate the leadership of Dr. Ezike, the governor's office, and the ongoing collaboration with fellow hospitals and healthcare systems as we work to respond to the evolving needs of our communities and navigate the significant demands on acute care capacity in response to the Omicron variant. COVID-19, the demand for care is high, the needs of our patients are significant, and the fatigue of our dedicated staff is very real. Despite these challenges, our commitment is unwavering and our resolve is strong, thanks to vaccines, booster, and established safety practices to keep our patients and team members safe. Thank you to the North Shore team for their adaptability and resilience, caring for our patients and one another. COVID positivity rates in our communities are climbing, and we are experiencing a dramatic increase in COVID acute care needs. At our 4 legacy North Shore campuses, Evanston, Skokie, Glenbrook, and Highland Park hospitals, cases have spiked over 200% from 46 patients to over 138 patients since the first week in December. The overwhelming majority of these patients are unvaccinated. We are continuously evaluating options to ensure we have capacity to meet the most critical needs while keeping the safety of our team members and patients at the forefront. We are doing this in a number of ways. First, we are dedicating teams of facilities like Glenbrook Hospital exclusively to COVID care in order to rapidly and efficiently address patient demand. To those with acute clinical needs, we have temporarily suspended all non-emergent elective procedures from January 3rd to January 14th. We are stewarding our COVID testing capabilities to ensure patients who are symptomatic or have had an exposure have timely access to COVID testing. We are shifting and providing care via telehealth to allow for convenient access points for our patients. Like other healthcare systems, we are adopting CDC guidelines that accelerate timelines for some staff to return to work and ensure the best care for our patients. Based on industry models, we are projecting months, as well as in our efforts to advocate that all are vaccinated, boosted, and follow recommended guidelines for social distancing and masking. We also look forward to the clinical advances that the newer therapeutics will provide our patients and communities. As care providers who are also family members, colleagues, friends, and members of our communities, we have never been more passionate or committed to delivering the highest levels of safety and care. We will continue to work closely with the governor's office and the many partners who play a role in keeping all of us safe. Governor, thank you again, and now I'll turn it back to you.
Thank you very much, Gabriel, and happy to take any questions from members of the media. Yes, Marianne.
Governor, why is Dr. Ezike not here? Didn't notice that he talked slightly, didn't want to be paranoid, but
I have been tested. I was tested this morning before I left my house. And in fact, I was tested 2 days earlier as well. So thank you for asking and your concern. Dr. Ezike, out of an abundance of caution, she had been exposed to somebody who had COVID and tested positive. Just being extra careful and staying away, but joining us nevertheless.
with the hospitalization so much higher. You've both of you, Dr. Ezike, always said, we're concerned not so much about case numbers, but hospitalization.
Yes.
So what's the threshold for more mitigation if that's what you're concerned?
Well, I think you're seeing that we are taking action here. A variety of things. One, very importantly, is that, as you heard Gabriel speak of, and Omar and AJ behind me, as well as Jim, that they are taking action within their hospitals in order to adjust elective surgeries. And remember, there's a wide range of surgeries that fit into this broad category that we often refer to as elective surgeries. Some are much more serious than others. And so they're working within their hospitals to take the much less serious but still elective and important surgeries to try to postpone those. And you heard once again from the 3rd to the 14th from Gabriel. And this is the way each hospital, and we've asked each hospital to make those kinds of adjustments. We also are, through our staffing contracts, trying to provide staffing to hospitals wherever they may need it, and they are doing everything within their hospitals to adjust staffing so that they can expand the available beds. And remember, when we talk about beds, ICU beds and hospital beds, we're talking about staffed beds. They may have a room with a bed in it, but if you don't have staff for it, it's not a bed that's available to a patient.
Governor, why not mandate for a certain period of time, like this surgery is being postponed, right? Up to the hospital.
Well, again, because hospitals are different one to another, and the kinds of procedures that they may need to postpone are different. A large hospital, for example, might have some plastic surgery that's completely elective that's scheduled. A smaller critical access hospital downstate, less likely to have one of those, more likely to have something perhaps more serious that's scheduled. And so they need to make those decisions on a hospital by hospital basis. Very early on in the pandemic, we had to move very quickly to make sure that hospital beds were available. And so we just had an across the board, temporary suspension of elective surgeries. Now what we're doing is getting the hospitals to make the decisions themselves, and they're doing it.
Do you know anything about the federal rollout of at-home tests? Will the IDPH be playing a role in that?
Yep. So we are not playing a role in sending at-home tests to people at home. That is a federal government endeavor. 500 million, as you know, tests that are going to be available to people across the nation who ask for them. on a website that the government is making available. In Illinois, what we're doing is making more free community-based testing available, putting mobile sites for people to get tested around, and then increasing the number of staff people that are helping the local public health departments to do that testing.
Would that speed up the PCR lab results then?
No, so remember that PCR labs, we have terrific PCR labs that are available here in the state of Illinois, and ones that are responsive to us and under contract to the state of Illinois. That's something we dealt with early on. You may remember that we really were one of the best states in the nation in the very early months when there was huge demand coming of testing, and many states didn't have it. So we worked diligently to bring down the amount of time between the time that you got tested and the time that you got a result. And we've been very successful at that. Now, demand is up again, but we've got labs across the state as well as in the region that are under contract to us to deliver at faster rates the results of those tests. So we feel pretty good. Again, you never know if we had another 100 or 200,000 people in any given day seeking, on top of the roughly 150, 200,000 that are seeking testing every day, perhaps we would have a bigger problem than we do. But right now, anyway, we think we're in pretty good shape. Having said that, there are, and we've dealt with this, the pop-up testing, you've heard of sort of, they're almost like, some of them may be fly-by-night pop-up testing, where all they're doing is taking the swabs and putting it in, the reagent, right, in the liquid that keeps it, and then they're not taking responsibility for how long it takes to get that test back from a lab that they may not have a very strong relationship with. And that is an enormous problem. And in fact, some of them are not even returning results at all. So we've referred this to the Attorney General's office, and working with the Attorney General's office, we intend to make sure that those operations are no longer doing to customers and patients what they have been doing. And instead, we're directing everybody to free community-based sites and to our local public health departments.
Governor Pritzker, the CTU tomorrow. Knowing the science and data, in your opinion, is it safe for Illinois students to class or have?
Well, I've said all along that it's better for our students to have them in class. And provided more vaccinations. And so we hope that school districts across the state will take us up on that. Many have, most have. Most are using Shield or something else that we've referred them to. So, I'm actually, as you know, the best thing is for kids to be in school and in school safely.
What are your thoughts about the new CDC isolation guidance? Are you confident with that? Rather than the 10, the 5 days? So much confusing.
I understand. And look, IDPH and Dr. Ezike, I don't know that she's still on, but if she is, perhaps she may want to respond. But let me be clear, the challenge that I think CDC is seeing that is particularly among healthcare professionals, that some are getting sick and having, they've been exposed and having to stay out of work for 10 days is just too long a period of time. We need our staffing as best we can. And so I think that's one of the reasons that they came up with the adjustments. I know that it can be somewhat confusing for folks, but this is, again, with the focus on the fact that we have a tremendous upsurge of Omicron and overall COVID-19 infections.
Greg Bishop from Center Square wants to know why there's 1,000 fewer staff beds in the state.
Well, I'm not sure what numbers he's looking at, but let me explain again how staffed beds work, right? It's not a bed. When he says staffed beds, it's not a bed if it doesn't have a staff person, right? And those beds that are available across the state are available because there is a staff person in the hospital that the hospital has designated to deal right now with the demand for staffing all over the country. And so you've got either fewer staff in the state of Illinois, or you've got more need for staff in ICU beds, which is a higher staffing ratio. I don't know whether you want to respond to that, Omar, if you have any thoughts about the number of staffing beds.
Is there any talk of reopening field hospitals?
So I could hit the staffing, but yeah, the staffing question is one of the painful realities of the pandemic. We've had the highest number of retirements and people leave their field in healthcare. We've had a high amount of burnout. And so that's one of the reasons that there's such an incredible need for staffing. So every hospital in the city, every hospital in the state, many of the hospitals in the country are competing against one another for the available staff. It's really a supply-demand issue. So we are desperately looking and actively recruiting, and it's basically a challenge to get people in to serve in these roles. And that's why it's particularly a challenging time right now, with the increasing numbers coming at the same time we have a decreasing staff. So it takes longer for people to graduate and come into the field than it is for, unfortunately, for the rate of people retiring right now.
I just remind everybody that there's been a staffing shortage even before COVID for hospitals, and it's gotten more acute as a result of COVID.
Is the state considering a vaccine mandate like this
Well, again,
for restaurants and throughout the state?
I just want to remind you, they're not requiring vaccinations. That is not a vaccine mandate, right? What they are requiring is that if you go into a certain kind of establishment, and they have a category of them, that you have to show that you've been vaccinated, right? That's the, so what I've done is, as you know, first of all, I think that the city and the county are doing the right thing for the people of the city and the county. I encourage local leaders to do what's right in their communities. Every community is a bit different, as you know. Some counties have very few restaurants. They're quite far apart from one another. They don't have huge crowds in those restaurants, and so it's hard for them to have exactly the same kind of mitigation that the city of Chicago might have. And so it's been anybody who's willing to step up and make the tough calls, and we've been making the tough calls at the state level as well. At the city level, at the county level, I applaud.
Governor,
Sorry, I just want to, catch you. Craig, yeah.
Governor, what evidence are you seeing that the kind of appeals that you're making and the health professionals here are making are having any effect? I mean, let's face it, when we were coming in, there was a demonstration downstairs with considerably more people than are in this room right now, saying we're against vaccines, we're against the mandates. Is this having any effect? Are people listening?
Those are not the audience for what we're saying. It's clear to me that people who are willing to come and protest against vaccinations, against masks, are not listening to the science. The people who are the audience for what we're saying are people who have been a little bit hesitant. They've been concerned. They read something on Facebook that they're not sure if it's true, and they haven't quite made the decision that it's time for them to get vaccinated. But let me be clear, here's evidence that what we're saying is working. People are getting vaccinated every day. Tens of thousands of people are getting their first dose. Tens of thousands are getting their second dose. And even more are getting their booster. So we believe most importantly, because what we're saying is true, that keeping yourself safe really means getting vaccinated, getting boosted, wearing your mask.
But Governor, there are going to be some that are going to say, if you really want to push up those vaccine numbers, then go ahead and have a statewide requirement like the city and county is driving up the numbers in New York. Why are you reluctant? Some believe it is political because of your election year.
No. As you know, I've been making tough calls all along. They're, evidenced by there are protesters outside who are opposed to masks indoors, masks for our children so they can stay in schools. So we clearly are making tough decisions. I just think that at this point we have vaccines available, we have treatments available, we have masks available. We've put in place these press briefings frequently who constantly is pushing the idea that, perhaps masks don't work or that we should take masks away in schools when we know that those masks are working to keep people safe. So it's important, though, that people understand what the truth is, and people who don't want to believe the truth, I'm not sure how we're going to convince them, people who are protesting about this.
All right, we'll do last one.
We're just asking about the Bradley shooting. We haven't talked about that. Any expedition? Contact with folks now.
No, I've had no
Alright.
contact about it.
Thanks, everyone.
For Mark Maxwell, can I have one, just about,
Sure.
what does the new transgender rules change at the Department of Human Rights mean for schools, and specifically, what will change?
Not a rules change. I can follow up with Mark after that. He
Yeah,
doesn't
there's
know.
a-
That's a different question.
It's school by school, they'll be making decisions, district by district.
Appreciate it.